and the patient can walk and get discharged on the same day.
Sir, now with this long journey and long experience and the more practice that you have done in different places, coming to the common surgeries that you have done, what is the surgeries that you see most of the people coming to your OPD with a complaint about back pain and all? What the most surgery that you operate on?
So if you see spine as such, so we do everything from cervical to lumbar, the entire spine we operate. And the most common condition, like almost 60 to 70% of the practice, it comes in degenerative conditions, in age-related conditions. So as you age, the spine, the discs, this is the spine. So if you see, this is the spine and the bones are there, the vertebrae are there, and in between there's a disc, which is like a jelly or a rubber. So that gets degenerated, that gets worn out. So there is wear and tear of this disc. So that can cause compression, that can bulge out and cause compression on the nerve. So in younger individuals, we are seeing mostly in younger individuals who come with disc problems because of the weaker discs, because of the weaker lifestyle. So they do prolonged sitting work, they don't do core strengthening, and they do smoking, and all that will cause wear and tear in the disc, and the disc can bulge out and cause compression on the nerve. So that is in younger individuals where we do surgeries like microscopic or endoscopic decompressions and disc surgeries. Nowadays we are doing mostly endoscopic keyhole surgeries where we just have to put two holes, and then one hole the camera goes in, the other hole the instrument goes in to remove the disc, and the patient can walk and get discharged on the same day. So the other part of the condition in degenerative conditions is in the elderly, where patients come with instability. So the spine can actually become unstable, or there may be degenerative scoliosis, the spine can tilt on one side, or there may be instability where the spine can move one over the other. So in those conditions we do something called a fusion surgery. So in fusion there are different techniques. So we can do the fusion by putting implants in the spine and then removing the disc and replacing it with a metal implant or a plastic implant called as cage. So that provides the stability of the spine, and then the decompression part of the surgery will help to relieve the leg pain and all that. So the other surgeries, this forms 60 to 70% of the cases. So the other surgeries, like 10%, we do spine infections. Like last week we had a patient who had an infection in the spine, he had an epidural abscess collection. This can be tuberculosis or pyogenic like Staph aureus or any other organism, even fungal. So this can compress on the spinal cord and cause weakness, paralysis. So we do decompression and stabilization of the spine in those cases. We do 10% of the cases tumors. So tumors can be primarily in the spine called as myelomas, or they may be secondary from spread from other organs like lung, breast, liver, kidneys, anywhere in the body, and then the spine can get affected. So in those cases where there is a vertebral collapse, there is a spinal compression, cord compression, we need to decompress and stabilize the spine. We need to reconstruct the spine. It's a very complex surgery. We need to reconstruct. I'll show you examples of those cases. We need to reconstruct the spine entirely. We need to remove the bone called as corpectomy and replace it with a metal or a expandable cage, and then could stabilize the spine. So again, the last 10 to 20% of the cases are like scoliosis and spinal deformity corrections. So spinal deformity corrections are like in kids, when the kids grow, either by genetic causes, by congenital or by birth, or as they grow, there may be something called as an idiopathic scoliosis.